Vaccines are the most efficient shields from various kinds of vaccine-preventable infectious diseases. In Eritrea, a nation in the Horn of Africa with a population of an estimated 3.5 million, vaccines are seen as lifesavers by all the 9 ethno-linguistic groups that live across the spectrum of the country. Today, 12 different kinds of vaccines are administered to children from 295 fixed sites and 450 outreach vaccination posts. Of the 12 different types of vaccine administered, vaccination uptake of 3 doses of penta, diphtheria, pertussis, hepatitis, hemophilus, influenza and tetanus, and 12 doses of measles, rubella were 281,028 and 513,974 respectively among the children less than 2 years old from 2019 up until April 2021.
This is in line with Eritrea's good performance on its full immunization coverage for under 5 children, and biannually we receive this chartered flight, and in ensuring and advancing full immunization coverage for children under 5 in order to align with the principles of leaving no one behind. So we would do catch-up round in order to cover Eritrea's full immunization coverage.
Supply of vaccine stock to all the 6 regions of the country is replenished every 4 months of the year from Asmara, the capital city of Eritrea. From storage facilities down to the village level, health workers carry vaccines in cold boxes and vaccine carriers, traveling by car, camel, or on foot to immunize every last child, even in the most remote of villages.
بزح مشاكل صادفينات حتى شهر أجنيت ناقل حتى عملت الأكان من قرب متنفع باللينا ديت قوي سكبرت عدم نجيس مرة ثلاثة وقاعدين مسحة وزلام أجنيت ناقل حتى دول ما عملت 90 مرة ربشته وقاعدين اللي ما مرة حمودام إحنا لكن زيادة هي نت الأكان نتنفع بنحزه لحما وعمسينا وحراساتنا نسرق مراقبة تقبلنا مرة سيت عبايبنا.
There are 6 administrative regions in Eritrea. These regions are called Zobas, and Zoba Anseba, with a population size of over 563,000, is one of them. This Zoba is one that is struggling to cope with recurrent droughts, climate change, and climate variability. Hamid Mohammed is a nurse midwife stationed in Habarut Zada Health Center. He and his team are preparing for a 16-hour journey on foot across a rocky terrain and dried-up rivers of the Habaro subzone to deliver essential vaccines provided by UNICEF to a small but inaccessible village of Habaro Zalim.
حجة هبرة صليب كابزا حكمنا زيادة اللي 9 كيلومتر ترحق يا مولد حجة تونسات كاب روحوق ينزل مزح كاب قارس حات الزبال ل 10 كيلومتر يرحق مولد قباي روحوق سلوكنا نكتبوا طعم نفيدو ونفاق مولد أنا مولد زي كتابتك كلهم كانوا راكبوا مولد حجي أنستسل زكونا أبزاكم مصاي كلهم أكتبوا طعم خيدنا كلاتهم كتابتك راكبوا.
The team gently sort vaccines from the refrigerator and place them into the vaccine carrier before moderating them with ice packs. They must remain cold, safe, and effective as they move from the facility to the villages.
حنت بلان صالح حنت ملاكس كنا كلنا زوبا تزوري كافل في الجمرة كساب جامد كحد جزء كم والله كالي زجاجل بكتابة يلا ولا بتناي كالي فيتامينات عليه الله مولد جن نعم كيرا ساقم كله كحد جزء حجي وانت بلاشيا بأسمر الله.
Another vaccination team mounts life-saving vaccines destined to reach another remote village called Hinab in Asmat subzone of Anseba region. Already, Asmat is 120 kilometers away from Karen, the capital of the region, and Hinab is 55 kilometers away from the health station found in Asmat. Over 1,500 families expect the team with eagerness every month for their children's vaccination. With no clear road to another outreach post in Imbaldai village of the same subzone in the region, the same team of less than 5 qualified health experts continues its journey through the path full of shrubs, maneuvering up and down through the mountainous terrain. But in all this, the vaccines mounted on the camel remains safe.
وأروحتنا كان حاوقنا كانوا ولا لهم سيات حباونا حبوب ما نايدو كلاس تكان على حباون أديما دول واجب في الديت يقول لك مميتة توالي بي ودقيقة وقمالية بي فطوالي بو.
Communication of the health workers' arrival is made 3 days prior to their departure over by phone to the schools in these villages, who in turn tell the students to inform their parents of the upcoming immunization campaign.
توم دي أمور على التلمسة قدام 3 أيام لحبرونا بدرسان دوريين هلا قدام سبت بنا لحبرونا قدام 3 أيام تاتعين هلا قلكم تأكبل بلونا لكن الحبرية لا بقبو دي باش عبد تبصحي تقدرنا مثل ريم لو وقت اللي درسي اللي نجازاتوني كنت ندي أنا سيجنا هو بالتاتعين لما تزيد حكمنا دي بمركزنا هبرة سعدة توم هيني ستفا هيني الأمبلانس حقي صنحت التعلت لإلا بيلو دي باي مسون لو أكل الإقامة من حديث كان يقايرو قلنا.
The vaccines are to be administered immediately upon arrival because there are no refrigerators to maintain the cold chain in these visited outreach posts. Immunization equity is strictly observed, and one by one, every child gets vaccinated. But only the mothers seem to be in attendance to their children's vaccination.
اللي تيجي سيد بلنين لكن كل راعتي قبي تقود قبي وبنوش قبي ومقلبو قبي كل بشوية بدرو فوتو لا تعكرا لا اللي تقاسها لا يملو بحلا بدها لا تقدعات كل راعتي قبي.
The Integrated Mobile Outreach Services program has improved children immunity against many kinds of diseases, including tuberculosis, polio, diphtheria, tetanus, measles, rubella, hepatitis B, influenza B, rotavirus, and meningitis in the hard-to-reach and underserved communities throughout Zoba Anseba in Eritrea, and are also helping improve the delivery of children and maternal health survival interventions. UNICEF and its partners are committed to safely provide essential immunization services for children in the most hard-to-reach communities in Eritrea.